Today is February 3rd, 2014. You're here for a 4-day ketamine infusion. Back in October 2013, you had a tetanus shot done in that left shoulder area, correct? Mm-hmm. I want you to start up here on your leg, okay, and I want you to work your way down. Remember how I showed you? Nice, light strokes like that. Close your eyes. And when you get to the area in that leg where it feels like road burn, remember the road burn signal, just stop and point with your finger. Okay, go ahead. Get started. There you go. Go on down. Atta girl. Good job. Let us know when you get to that road burn.
Right here.
You hit it right on the nose, girl. Right on the nose. Okay, very good. And of course, you're going to have the same problem on the other side. Go. You cannot weight bear safely. Okay, we know that. But what I want you to do, you see where your mom's sitting? She's going to get out of that chair and she's going to spot you to make sure it's safe. And I want to see what you can do on your own and transferring yourself as much as you can on your own from that chair over to the wheelchair. Do as much as you can on your own. Mom is watching you. Atta girl. Good job. All right. Very good. Good job. Good job. Grandma has some questions for you.
Grandma.
Here's Grandma. Here's Grandma over here.
Hi, Elizabeth.
She has some questions. She has some questions for you. Go ahead. Elizabeth.
It's okay.
I noticed that there's a green lizard outside. Can you tell me what I noticed was outside?
Okay, so today is February 11, 2014, and your last ketamine infusion was on a Saturday. And so now we're about 2 to 3 days beyond that point.
No concerns. In fact, midway through the second infusion, I was comforted when she told me that the burning pain was all gone.
Yeah.
As she was trying to pull out her IV, I'm done. She
Yeah,
says
right.
no.
Right.
It was emotional. It was hard.
Yeah.
But it was a very positive experience, especially compared to the last 4 months and 4 days that this took a toll on her life.
Right.
Stopped.
Exactly.
Well, and I think it's interesting to note that the CRSP, the RSD, actually changed her ability to work with us. She didn't used to be combative and refusing to do things like a 2-year-old like that.
She became very 2-year-old-like behavior. You couldn't reason with her, you couldn't talk to her. And that started the minute the RSD started.
Yeah.
It was like I couldn't reach her. It was why I think a lot of doctors thought that this was psychological based and not anything else.
It didn't happen to her, but I'm telling you, I've seen it more than once. Many times I've seen it in kids. Not so much in adults, but in kids. And what happens is the stress from the pain becomes so severe that there is a protective mechanism that sets in. We call that a conversion reaction. And what that is their legs can become paralyzed. They can't move. They may even lose the ability to feel things in their legs. Sometimes they can go blind. They can't see. But you can take them to an ophthalmologist, there's nothing wrong with their eyes. Okay? All right, so all of these things are called conversion reactions. So I've seen that a lot in kids. So these kids, they need to be seen at by specialists. So this looks like she's got the CRPS, and the conversion reaction is what any normal human being would do when they're put under extreme stress and extreme pain, and it's not something she has no control over whatsoever. We see this a lot in patients that have CRPS. Talk a little bit about what a conversion reaction is. By definition, a conversion reaction means you've got some kind of thing going on, usually a movement disorder, and of course a seizure-like activity or movement disorder is a movement disorder, okay? But you can't explain it on an organic basis, okay? It doesn't follow the dermatomes, the wiring in the body, and so forth. So these doctors didn't have enough knowledge, enough skill. They just weren't competent enough to recognize that. And unfortunately, when doctors can't figure something out, it's easy for them to say it must be an emotional, it must be purely a psychological thing, okay?
Yeah.
You're not going to do a conversion reaction while I'm standing here. I'd like to get that documented. And so the plan here is to do a 4-day ketamine infusion. By the way, this is a PICC line they have in you right now, and it looks like it's not sutured in. So that's good news. We have to keep an eye on that. For any evidence of infection, that kind of thing. We talked about that risk, so we're going to, and you're a nurse, so you know exactly what I'm talking about.
Yeah, I'm looking after it.
Right.
Correctly so far.
Right, exactly. What I want you to take that right hand behind your head, see if you have any pain. Any pain when you do that?
No.
Do the left hand, please. Any pain when you do that?
No.
I want you to see if you can wiggle those toes for me at all. Just give it your best try. I don't see any action there. You getting anything? See if you can bring your knee off the ground here. Can you bring your knee off the bed? No, you can't even move it, can you? Now over here on your left side, again, the same thing. Let's do your toes first. You can wiggle those toes. A little bit of movement there, huh? Okay, very good. See if you can bring that knee off the bed a little bit. Can you do that? All right. And just to summarize, they can't do it. So just to summarize, from your waist on down, you got allodynia throughout this whole area, correct? Real sensitive skin. Okay, very good. Just pick it up from where she came back and she was paralyzed, she couldn't move her legs, and take it from, just give us a brief synopsis of how things have been going.
Yeah, we reversed the paralysis with a 4-day ketamine infusion.
But as you didn't even know you had it spreading down into your leg and into your face until we actually did these measurements on you, right?
Yes.
So another thing is, unless the doctor really does a careful examination, they don't appreciate that this is a disease that can be widespread. And in your particular case, practically the whole left side of your body. The doctors down there said this is all a psychological problem. This is a psychologically induced conversion reaction, right?
Yeah, versus malingering.
Malingering, right, which is not a diagnosis, that's an accusation, isn't
Yeah.
it? So what we can do here is we can say, another conclusion, we can say this is RSD related, and all the doctors that gave all this false and misleading information, they're the ones that got a psychological problem, big time. There are some doctors who actually torture patients that have CRPS. Now, if they're doing it intentionally, of course, that's a crime. But a lot of times, most of the time, it's unintentional, and it has to do with their ignorance. They don't know what they're doing. Doctors, some doctors, actually torturing patients, and we discussed that earlier, where if you torture a patient, physically torture a patient, or even mentally torture a patient, it's a crime. There are instances, and I think this is one of those, where you were tortured. Not necessarily intentionally, because the doctors were just ignorant. And when the stress is being generated by a doctor not giving you adequate pain control, as in my opinion what's going on here, it just adds to it. Now there is evidence to support what I'm saying, not just the anecdotal thing I said earlier about tying, like in Prisoners of War, tying piano wires to men's testicles and actually kicking them in the testicles, causing serious injury, where they have a conversion reaction. But there's now very solid evidence that if you stress a patient, particularly in torturing them, you can trigger a conversion reaction. And as you've learned, when we do something very specific to treat your pain, give you the ketamine, which I asked them to do, which they refused to do in the hospital. When I gave you the ketamine, all of this reversed. When you accuse a patient of making something up, feigning, malingering, that's not a diagnosis. It's an accusation.
They started to accuse me and Andrew and decided that we were reinforcing her symptoms and suggested that if we stepped out, that her symptoms would improve when she has less stimulation and feedback. It's a big regret that Andrew and I did step out for that one night, because that was the worst night for Hannah, and in fact none of that happened, and yet they still disregarded what happened going forward. Her other leg converted and she was paralysed then in both legs after they had suggested that Andrew and I were somehow also responsible for causing this.
So the point is, when doctors are ignorant, they don't understand something, they always are looking around for some kind of excuse besides their own ignorance. Blame the mother, blame the husband.